Hi, this is Colleen Parsons with your Head and Neck Vessels Assessment, Part 2, which is corresponding with your cardiac assessment. Like in most things, we're talking about your subjective data. You can imagine how important getting a good health history is for a patient with cardiac history. Actually, it's important if they have anything wrong with them to get that good cardiac history so that we are able to set either a baseline if it's a healthy patient, and what that baseline does is help us determine if there is a problem through ongoing visits. We're also trying to eliminate any concern for the patient. Patients have an awful lot of concerns about their cardiac status and what that means. Whether they verbalize it or not, many patients, especially men, have a family history of fathers, grandfathers, uncles dying early from cardiac complications and early in life, like in their 40s and 50s, which causes men a considerable amount of concern. They're afraid they're going to die or have complications as well. So helping stay ahead of that is very important. So things like cough, fatigue, cyanosis, edema, those are all very important aspects to be considering when we are managing our patients. This part of your chapter goes through it absolutely beautifully, the kinds of questions that you really want to be asking with regard to chest pain. Any chest pain, when did it start? Where do you feel the chest pain? Exactly what does it feel like? Is the pain brought on by activity, rest, emotional upset, eating, sexual intercourse, cold weather, whatever is going on for that patient? Try to get as clear a picture for the healthcare team as you possibly can. Are there any other symptoms that happen at the same time? Are there any medications that the patient takes that help the chest pain dissipate? How about shortness of breath? Does that occur for the patient when at any point? Because that can, especially when they're lying down or sleeping, that can be a warning bell for cardiac issues. How about a cough? How long have they had the cough? How frequently is it? Does it relate to a specific time of day? Is it dry, hacking, barking? What does it sound like? What is the mucus, if there is any? What does that sound like and look like? So again, respiratory questions are also related to cardiac issues. Does activity make it worse or better? And what about any medication the patient is taking? How about how tired are they? Now, that does happen with other comorbidities. Fatigue increases, especially as the day goes on. So you'll be able to sort this out, but you want to be asking the question so that the healthcare provider can get that really wonderful picture and be able to put the pieces together. So you're asking how many pillows does the patient use when sleeping or lying down? Do they notice any blueness, especially around their face? Do they ever look kind of ashen or whitish, grayish color? What is actually going on? Do they wake up in the middle of the night with an urgent need to void? How long has that been occurring? How about edema? Do they have any swelling of their feet or legs? How much swelling would you say there is? You're going to be learning to assess for edema, and how that plays out is a very important part of the cardiac assessment. You're going to be asking any history questions, going all the way back to birth. Were there any cardiac issues at the time of your birth, especially if the patient is talking to you about cardiac issues, or if you're working in a cardiac unit? These questions become even more important. And you're not going to be able to remember all of them, so you remember the basic ones. And if you do end up working in a cardiac unit or a cardiac intensive aspect of healthcare, then you will learn more and more questions to ask. Personal habits, nutrition, smoking, these are part of your basic questions. You know that that's true, but you're going to keep it in the back of your mind. How is this affecting their cardiac condition? And as you're listening to this, their health history, you're saying, okay, I might need to do a focused cardiac assessment on this patient. Alcohol, exercise, drugs. Very interesting to note that some drugs really have, of course, some drugs that are prescribed have an impact on the cardiac status, hopefully in a good way. But drugs like cocaine, for instance, can cause cardiac problems, long-term, permanent cardiac problems. Again, we're going back to infants, especially if you are concerned. So there's an outbreak of measles. We're very concerned with rubella and how that affects the heart. We know that to be true. We have known that for centuries, that rubella will cause cardiac complications in fetal development. If you do any pediatric nursing, you will learn how cardiac assessments are also very important for children and pregnant women, because of course the pressure of being pregnant changes the blood flow, it changes how the organs are positioned, it changes the pressure on the vessels, the blood vessels, and the cardiac status for the pregnant mother. The aging adult, we've already talked about this a little bit, adding that history, getting as much information, and it can be very detailed in an aging adult. We still have more people dying of cardiac disease than any other of our diseases, but we can keep people alive longer with good medication and good intervention. And that's the end of part 2.